Welcome to the half hour kind of 45 minutes to health. Okay, tonight we're talking about autoimmune disorders. Now, this is the most popular, it's actually the fourth most popular disease known, and it was almost unknown about 40 years ago. Now, what's frustrating is a lot of different diseases fall into the same category because it's the same cause. So does that mean like Hashimoto's and Graves' disease and rheumatoid arthritis are from the same cause? Kind of. But it's not really the immune system going crazy. It's actually the body attacking itself. The immune system's acting correctly. Now, what's frustrating when you look at the research of this, they say autoimmune disorders can affect these organs. Can anybody see anything that's not marked? I mean, hair's not marked. But I actually have a patient that, you know, hair loss is part of some autoimmune disorders. So it just doesn't make sense. If all of these organ systems are being affected in certain disease states, what's causing the dis-ease? Well, now the way the medical system is laid out is completely inconsistent with health. Now, see, they've divided the body up into specialists. So you go to the gastroenterologist, you go to the, well, if you have an autoimmune disorder, you can go to the nephrologist, which is actually a kidney expert. Now, is he aware that the sympathetic nervous system, like a fight or flight system, can alter kidney function? Is he aware about digestion, this nephrologist, about certain nutrients? Is he aware of that soluble fibers which clean the arteries? Is he aware that the pituitary gland and adrenal gland will alter kidney function? Is he aware that serotonin, which is produced in the gut, if you have healthy, appropriate gut function, is going to alter kidney function? Is he aware of that?
Should be.
He's not.
Probably not.
He's not. And it's the same thing when you go to the rheumatologist. These guys are for rheumatic diseases. They're going to look at joints and immune system problems. Are they aware that digestion, nervous system, sleep, all of those are factors in these diseases? They should be, you're right. They're not. When you go to the neurologist or the endocrinologist is he going to look at how certain foods can alter behavior function? Is he aware of the fight or flight system, the sympathetic or the parasympathetic? If those two nervous systems are functioning correctly, are they going to alter endocrinology? I mean, see, the system's broken up into so many different systems, and the way the medical world is the general MD is going to refer to all of these specialists. Now, all of these specialists, the only way that they can justify their position on staff at a hospital is to make a decision, prescribe. So has anyone ever gone to the hospital in here or had a relative go to the hospital? Yeah. Okay, what happens when they go there? Do they get they have the admitting doctor? Do they call another specialist?
Oh, yeah.
Okay, now everybody's going to say yes, and I'm not even asking what they were in for. It could have been a motorcycle accident, a stroke, falling down, dizziness. They're always going to call one or two specialists. And this is absolutely inconsistent with health. Voltaire said it best. Doctors are men who prescribe medicines of which they know little to cure diseases which they know less, and human beings whom they know nothing. You can't be a specialist and be effective in health. And that's how our entire healthcare system is laid out. So I get these people calling me from literally all around the world saying, look, you know, I went to my endocrinologist, I went to Johns Hopkins, I went to the finest hospital in Glasgow. You know, I mean, these people from all around the world, they're locked in a system that has the same type of specialists. And they're doing, they're breaking it up into areas that don't make sense. Now this guy, Dr. Koch, he developed the idea that one germ can cause one disease. And this is pretty much what the medical world is going for. See, they're looking at disease, and this is dis-ease. All diseases, including autoimmune disorders, that there's one cause, that there's one bug that causes one disease, that there's one tuberculosum bacterium that causes tuberculosis, there's one, you know, Pseudomonas aeruginosa that causes gangrene. There's one bug that causes one disease, okay? However, and that's what it's called Koch's postulate, this actually isn't true. Because the real system, the real cause of disease is a weakening of the immune system. We already know that most bacteria, you actually have thousands of bacteria inside of each cell. And those you have a harmony with. I've got staph on my arm right now. How come I don't have a staph infection? Because I have a healthy immune system. If I compromise the blood supply and nerve supply to it, will I develop an infection? More than likely. So the real cause of disease is a weakening of the immune system. Now, when they've done the Human Genome Project, we found out we had 25,000 genes. Now, that's unusual because it doesn't make sense that these genes, when they started the Genome Project, they thought we were going to have like 500,000 genes. But they only identified 25,000. So this means those genes, they do things that we're not aware of yet. When we went further into it, we found out that there's over 1 million bacterial genes in our body. So there's a lot of stuff that our advanced medical world doesn't get yet. Like they don't know why we have, you know, a house mouse has 92% of our same DNA. Maybe we should study more mice. You know, I mean, it's why does a monkey have 99%? Why does a banana have 25% of our DNA? So we're looking at this as genes. We're not quite sure how they work. We really aren't. So when you look at this, autoimmune disorders are when the body immune system reacts properly in the wrong direction. See, the immune system is designed to identify a pathogen, kill that pathogen, and eliminate it. Okay, and that's called an oxidative metabolism. This is why your body produces 10,000 cancer cells a day and you eliminate 10,000 cancer cells a day. So there's a harmony with this environment. Your immune system is designed to attack certain areas and eliminate those viruses, funguses, or bacteria. The problem is, if this immune system recognizes the joint has a pathogen, you're going to develop rheumatoid arthritis. If it recognizes the skin as a pathogen, you're going to develop psoriasis. In both, it's psoriatic arthritis. If it recognizes the heart, lungs, kidney, immune system, you're going to have lupus. If it recognizes the brain and spinal cord, you're going to have MS. I mean, when you look at this, what is, the immune system is functioning correctly in the wrong direction. Okay, does that make sense? So we have to start looking at what's the state of art, the state of the art of medicine. I mean, it's 2012. We're really advanced. So since we have this immune system that's recognizing non-bad guys as bad guys, what do? State of the art of medicine, they suppress the immune system. They suppress it with a medication. They're generally called steroids. Now you might think weakening the immune system, doesn't that predispose you to other diseases? Yeah. I mean, it doesn't make any sense, okay? Because nobody's asking the question, why is the symptom here? Why is the body reacting this way? Why is that immune system, which is designed to recognize pathogens, why is it attacking itself? They're not asking that question because they don't want to know the answer, because we already know the answer. This is part of it. If you look at the effects of a medication, the effects of injecting foreign viral proteins into your bloodstream causes the body to build an immune system. We know this. We know this. This is actually how vaccines are actually measured to be effective, is we measure the antibody response. Now, we've never done an experiment where we're injecting 81 vaccines by the time they're 6. We are doing it now. We're actually, currently in California, it's 74 vaccines of 16 different viruses by the age of 6. If you add in the antigens, it's actually 92 antigens. These are foreign toxic proteins injected into the bloodstream to stimulate a child's immune system. Now, we've never done this experiment. How's the experiment working? Well, we have about a 1 in 38 autism rate. We have, multiple autoimmune disorders. Cancer rates are skyrocketing. 14% of the Americans' kids are in special needs. So they're getting dumber and sicker. Okay, so the experiment's not working. So I'd absolutely recommend to opt out of it. Now, one of the reasons the vaccines aren't working correctly, or maybe they are. I never thought of that. They're designed to stimulate the immune system to attack. they're just not real good at what they're attacking. Okay, so maybe they are working, they're just not working right. Okay, so when we look at this, and this was out of the Journal of Autoimmunity, even though the data regarding the relationship between vaccine and autoimmune disease is conflicting, autoimmune phenomena are clearly related to immunization. Now, this is published in the journal. So what's causing it? They found the mechanism. It's called molecular mimicry. Now, when you do this, and again, molecular mimicry, this has been around since 1985. Diabetes, lupus, scleroderma, rheumatoid arthritis, yes, those are all autoimmune disorders, and they say that it's from molecular mimicry from the the medical procedure called vaccinations. Now, when you look up the CDC's website, now, they're an organization, government organization, designed to sell vaccines. They make a tremendous amount of money doing this. According to the CDC, and let's just go over hepatitis B. We're not going to go over the 74 shots of the 16 different viruses. That would be too complicated. So let's just take one. Let's just take one shot in one human, okay? Not 74. So if any results that we have of this, you can multiply it times 74, and if that scares you sufficiently, then I've done my job. Okay, because I want you to, you can't just blindly go on to this. I mean, this is being put on YouTube. You can't blindly submit to a medical procedure without looking at the risk and benefit. First off, if you have antibodies from a medical procedure of greater than 10, okay, that's international units, then you're protected. Well, what they did is they thought, hey, let's check. So they checked in adults, adolescents, and infants pre and post a shot. Well, they found infants at 4 months old after they got the shot, they had 2,942. Now, greater than 10 is protective. What happens when you have so many extra antibodies? Well, we already know from that article from 1985 that there's molecular mimicry, that those antibodies, instead of attacking just the hepatitis B, they're floating around, they're warriors, they're looking for something, there's nothing else to do, so they attack the self. So now let's multiply this times 74 times. If it attacks the central nervous system or the brain, autism, multiple sclerosis, okay, cancer. So I mean, this is not. Now, this is out of the physician's desk reference. So when the doctor is sitting down thinking, what am I injecting into my patients? This is out of, it's called a PDR. This is one of the contents of the vaccines, okay, infected dog and monkey tissue, pig and horse blood. But you know, don't think it's barbaric. This is, in order to grow a virus or bacteria, you have to have a medium that they like to grow in. And you can't really separate it out, so you gotta, you know, some of the tissue is going to get through the processing. Now, it's interesting, when we talk about sudden infant death, when we talk about no shots, no schools, peak incidence of SID, sudden infant death, occurs right at the same time when they're getting immunizations. Now, there's a vaccine adverse reporting, it's called VAERS system. They say only 10% of the incidents from vaccine damage are reported. 1 in 175 who have DPT series suffer reaction. 1 in 300 have seizures. What's frustrating is when you look at the DPT, what's the risk of a child acquiring whooping cough and dying or getting permanently injured? Or what's the risk of a child getting damaged or permanently injured from the therapy designed to prevent whooping cough? Are any of those questions ever asked? Well, it's time to ask them, because it turns out that it's 3,888 times greater risk of getting damage from the shot than getting damage from the whooping cough. So we got to start changing this. And then when you look at the side effects, and these are actually on the label of the vaccines, so when you look at, you know, you can call them side effects, but they're actually effects. And you could see Guillain-Barré, paresthesia, encephalitis, that's swelling of the brain, that's loss of control, that's autoimmune disorders. You know, these are all the body attacking itself. So what it boils down to is your body, if you build up faster than you break down, you have health. If you break down faster than you build up, you have disease. It's really that simple. It's like I had a patient with Crohn's disease. And Crohn's disease is a massive inflammation of the intestinal tract. Now, when you look on the natural health websites, you can cure Crohn's disease in about 30 days. You look on the medical websites, remember, the medical websites where you have the nephrologist, the rheumatologist, the gastroenterologist, that, you know, those, there's no cure for Crohn's disease. Okay, so I told her, now get this, tell me if you don't think this is cool. Don't put anything in your mouth that causes inflammation. Huh? Was that good? Was that good? Okay, then I really kicked it up a notch. Only put stuff in your mouth that is anti-inflammatory properties. Wow, I know. Can you guys hear the angels singing? Can you do you feel the goosebumps? Because when you think about it, that's so simple. She said, no one's ever told me that. And I said, good, you're going to go on a diet of fresh fruit and juices, and you're not going to take any animal products at all, no grains, nothing like that. Any vegetables you're going to have, they're going to be juiced, and we're going to recover your intestinal tract very, very quickly. Now, she has a sedentary job, okay, so now when you sit, you increase the pressure on these discs 5 times normal. Now, those nerves also supply the lower intestine. Guess which part of her intestine was inflamed? Yes, the lower intestine. Oh my gosh, let's connect the dots. So I told her, you know, we're getting pressure off the nerves, and she's going to heal in about 30 days. So this is how disease is reversed. You do stuff that's good for you. You stop doing stuff that's bad for you. Now we got to talk about swelling or inflammation. Have you ever heard of anti-inflammatories? Okay, like Advil, Motrin, you know, Tylenol, ibuprofen. Well, that's stopping a repair process. What's tough is they don't even say how they work. I mean, Tylenol, we really don't know how it works anyway. Okay, when you look at the clinical pharmacology or the mechanism of action of Tylenol, I love the way they worded it. The mechanism of action remains elusive. It's, how do you say eloquently, we don't friggin' know? Elusive. I just like that. The rest of them, we know they inhibit proteoglycan production, which is the building blocks of cartilage. So if you take an Advil or Motrin or anything else, it inhibits the building blocks of cartilage. Hi, this will help with the joint pain. It's going to eventually cause the joints to be destroyed. So that's foolishness. What we do know is that acute inflammation is fantastic. It actually repairs skin, rebuilds skin. It's excellent. That's what we want to promote. That's how we can regrow discs. That's everything. Chronic inflammation will cause you to die. And this is everything. So what type of things cause chronic systemic inflammation? This chronic systemic inflammation, there's a cross-section of an artery. This is the source of most diseases. So what causes the body? Remember, you scratch yourself, you got inflammation, that's how the body heals itself. Imagine if you had that inflammatory response in every artery, in every organ in your body. Okay, you would have excess histamines produced. You would have systemic inflammation, and this is where most diseases come from. Well, when you look at this is the cross-section, okay, of human beings. We're exposed to materials that are put in our body that are masquerading as nutrients that cause systemic inflammation. They really are. Did you know that Chinese people eat more than Americans? They eat more calories. But they don't have the obesity problem because they're not eating processed synthetic foods. So your body's really efficient. If you take in a nutrient that you can't use, it's going to store it. And then if you take in stuff that actually damages all the arteries, you damage an artery just like you damage skin. If I keep scratching this, what color is my arm going to turn? Red. Red, exactly. If I keep scratching my arteries inside or my kidneys, okay, what's going to happen? They're going to turn red. They're going to inflame. So if we put stuff in our body that causes a systemic inflammatory response, we're going to develop systemic diseases. And this means the stuff that's approved by the Fraud and Deception Association, like the burger at Carl's Jr., or the chicken over at the chicken sandwich. I mean, last couple of months ago when we talked about foods that kill, I brought up the ingredients of a fillet of fish and just the fish patty. I mean, that was shocking. You can't put chemicals in your system and expect a positive outcome. We're not even talking about genetically modified proteins that go in there and irritate the lining of the arteries. This is not a problem with control. It's a problem with getting nutrients in your system that your body can't process, and you store it or you end up with disease. This one here, I know, just reading this, it makes you hungry, doesn't it? Okay, back in the 60s, I actually had these. Okay, and these were one of my favorite foods. My sister would actually pop them in the toaster. And of course, at the time in the 60s, they didn't have high fructose corn syrup that was genetically modified. So the stuff I was eating was a little bit healthier. They didn't have soybean, cottonseed, or hydrogenated cottonseed oil with TBHQ and citric acid for freshness. We didn't have genetically modified cottonseed oil at the time. So I was getting less toxic proteins, so my sister doesn't need to feel guilty of giving me a toxic poisonous product. Okay, I just want to alleviate her of that. But when you look at the rest of the garbage in here, partially hydrogenated soy and cottonseed oil, again, modified cornstarch, xanthan, soy lecithin, peroxide. Anybody know? Yes, this is it. Okay, why is it legal? Okay, you've got a child. Picture this. Somebody walking down, child in the cart. He takes the Pop-Tarts out, leans over to feed it to the dog. What's the mom going to say? Don't give that to the dog. It'll make the dog sick. That's for you, honey. Oh, man. We have got a system that we need to change. Well, this is one of the things that's interesting. With the food products like that, it's changing DNA production. This is one of the sources of the autoimmune diseases. I mean, we already know the vaccines, the medications, the segmentation of our medical care. This is the absolute mechanism of why the DNA changes inside of the cell. You change the DNA inside of the cell, those antibodies are going to flip out and they're going to start to attack itself. Now, this is called a nuclear transcription factor kappa B. Now, it's a light chain enhancer. What this is, it's a protein that actually turns on DNA production, and it can turn it on healthy or bad. Now, if it's linked, because it's linked to inflammatory diseases, if this is turned on bad, cancer, again, arthritis, Crohn's disease, Alzheimer's, multiple sclerosis. So you're seeing all of the other rheumatic diseases engulfed in this too again? Just like you saw all the rheumatic or all the autoimmune diseases clumped in the vaccine side effects, they're all clumped in this one too. Now, fast foods, everything else, actually stimulate, or toxic foods, genetically altered foods, they stimulate the production of this. The inflammatory response does. It's interesting. This is wild. These are all types of food that grow. They're called fruits and vegetables. They inhibit the production of this. So if you have a diet high in fruits and vegetables, it's good for you. I know. It's crazy, but when we look at this, the Human Genome Project, okay, because it all goes on genes and gene production. That's why we're looking at the stuff that creates genes. Cancer is not genetic. Autoimmune diseases are not genetic. Diabetes is not genetic. It has to do with genetic expression. And that's the big kicker. So if your body can suppress the cancer gene, you're never going to develop it. This right here, vitamin D is the #1 thing that you've got to take to reverse cancer, or to reverse autoimmune diseases, and cancer as well. Most people are vitamin D deficient. We've been sun-phobic for about 35, 40 years when they started to come out with certain types of chemical sunblock. And when you look at the sun-phobicness of our culture, we're getting less and less vitamin D. I'm not even talking about the toxicity of the sunscreens. That's just beyond belief. When you look at most sunscreen products, if they're exposed to the sun, they can create cancer-causing agents. Okay, so no sunblock when you go in the sun. Okay, that's going to be essential. Shirt, hat, everything, but you need to get at least half hour to 20 minutes of sun every day. If you live in a northern latitude, you got to get a sunroom. They're doing this in Europe a lot. If not, you need to supplement with vitamin D. But this is essential because it's involved in over 2,000 units. Typically, the dosage is 3,000 units for every 100 pounds of body weight. So 5,000 international units for the average person, absolutely appropriate, year-round. Now, we're looking at this. When you look up vitamin D deficiencies, you start thinking, autism? What? Could this be why a mother, if she's vitamin D deficient, has more chance of her child becoming autistic? Wow. Could it be that since women, if they get Pitocin during the delivery, there's a higher rate of autism? Could it also be that there's a higher rate of autism in pregnant women who've had multiple flu shots? And there's a higher rate of autism in kids that have had vaccinations? Could it be one or all of those factors? We don't know. We're not studying it. Okay? Remember those 3 blind mice? Okay. Yeah, it's better just not to ask. So when we look at this, vitamin D deficiencies, autoimmune disorders. So what causes autoimmune disease so far? We know vaccine toxicity, we know vitamin D deficiency, we know toxicity from the medications and toxicity from the foods. Wow, it looks like deficiency or toxicity is it. So here, Becky, sweet gal, okay, she had demyelinating of the nervous system. This happens to be, and she was the mother of 2 kids, okay, young gal, really sweet. When you got 2 young kids and you got a future of being in the wheelchair, is that scary or scary? Yeah. Well, now, she did drink Diet Coke. Now, Diet Coke has a sweetener in there, that's chemical, that breaks down at 86 degrees. Wait, what's a human body temperature again? 98.6. Well, that's higher than 86, isn't it? Well, that would suck if you were human and you drank some of this, wouldn't it? Because it breaks down into formaldehyde and wood alcohol and has demyelinating symptoms. It can actually cause multiple sclerosis-like symptoms. So all diet products are incredibly dangerous. Yes, she was doing Diet Coke. Yes, she had a lifestyle where had a lot of diet products because she'd just given birth, she wanted to get skinny again. Well, she goes in, and the only way to diagnose MS is you start to lose control, and then they do a scan and they find brain lesions. Sure enough, they found the brain lesions. She comes in, we get her diet cleaned up, we get her nervous system working correctly. This is her neck. Obviously, it doesn't have a beautiful curve the way a normal neck should, and that was also changing the firing of the nerves up to the brain. Well, 90 days goes by, her symptoms go away, she gets a second brain scan, and there's no lesion. Go on, say it with me. That's a miracle. Yeah. What's frustrating was you look at this, human beings are the miracle. We don't know how you work. We know kind of roughly. We don't know that, I mean, we used to think that glial cells in the brain were just the glue. Now we know that they direct stem cells. We don't know how that happens. We don't know how a lot of this stuff happens. So if the doctor says this is exactly what's going on with you, he's ridiculous. This little gal, darling, I mean, this is a normal curve. That was her curve that she walked in with. Her mom wanted to get her put on disability. She had rheumatoid arthritis, okay, and fibromyalgia. Now, the only way to diagnose rheumatoid arthritis is you get a blood test, and it has a positive RA factor, and then along with joint pain and stuff, okay? So her mom wanted me to put her on disability. Little 12-year-old on disability. So what causes rheumatoid arthritis? Excess antibody production from the vaccination, attacking the joints, or toxic food products, or with her, birth trauma that damaged the neck that caused multiple ear infections. If you get multiple ear infections, what do they give you? An antibiotic. Okay, good. Now look at her history. I mean, let's do this real simple. History of ear infections, so she had antibiotics, so she had the normal bacteria in her gut wiped out. She can't absorb healthy nutrients, but her mom would give her the Pop-Tarts, okay, and the Lego Eggo waffles every morning because she wanted to have a good breakfast. So that's more toxic nutrients, fully vaccinated. Okay, why this kid survived is just, I mean, you should just go back and say it's a miracle there. So I said, well, you know, instead of putting her on disability, how about we work with her and get her, you know, get her nervous system, get her body cleaned up. Sure enough, within 30 days, no more symptoms. She goes back to the rheumatologist, who must have been Mr. Personality. He goes up to her, your daughter's rheumatoid arthritis is in remission, and walked out. Now, I don't know if her vocabulary was that big. She said, what's remission? And I said, honey, don't worry. It means she doesn't have it anymore. It means the blood test came out RA negative, so she doesn't have it anymore, okay? So I get a call from her about 2 months. They ended up moving up to Apple Valley. And she said, oh, what's wrong with my daughter? Her legs are so sore. They're so sore. And I said, well, what was she doing all day? Playing like crazy. What? I've never seen her play like that. Okay, I know. You just know. Okay, I mean, it's pretty much, most of the questions I answer are just common sense. Give her a hot bath and, give her a good, coconut veggie drink and, she'll be all happy. And then you look at this, fibromyalgia. This is ridiculous. This gal is a hairstylist. She's on her feet. She's dealing with people all day long and multiple toxic chemicals. Okay, if you're taking in multiple toxic chemicals and you're not taking care of the free radical formation, you're going to have major toxicities. This was her lumbar spine standing up. Okay, so depression and anxiety, what did they give her? Knowing that depression and anxiety come from lack of serotonin in the gut. That means her gut wasn't functioning, it wasn't producing serotonin. So what do? We got her on a healthy diet. We got her eliminated from the toxins, got her nervous system adjusted, got her on certain omega-3s and healthy stuff. The hardest time I have with autoimmune disorders is getting people off of the friggin' medications. Getting them off of the antidepressants. That takes me about 30, 45 days to get them off of. Pain relievers, it's easy. We can get them off of usually about 3 to 4 weeks. But the steroids, that usually takes about 2 weeks to get people off of. Healthy yoga, exercise. And this is it. This is on the back of the handout. The solution for autoimmune disorders. It really, really is this simple. Don't think that it's any more complicated. You absolutely have to get the nervous system checked. That's primary. The nervous system controls the immune system. That's primary. Okay, after that, and it's just like if you walk in this room and the light's not on, you're not going to run out saying, good God, let's go to the power company. You're going to check the switch. And if the switch isn't working, you're going to check the breaker. If the breaker's not working, then you're going to call the power company, okay? So we start off with the most obvious and work down to the more finer points. So first you got to get your nervous system checked. Then you got to get your vitamin D levels checked, absolutely. You have to optimize your omega-3 intake. Best source of omega-3s is algae. They now have a stable form of algae. We're going to start carrying it because we've been carrying fish oils for omega-3s, which has been the finest fish oil in the world, or the finest omega-3. I found a better form. And I've been looking for this for like 10 years because algae is the best form of omegas, but they couldn't make it stable form. They now came up with it, and I'm really stoked. If you're into research, it's really like stable form of algae omega-3. Yeah, baby. Well, thrilled me. I need one of those little cricket things. Okay. Avoid absolutely. No processed, no animal products. I mean, particularly if you look at chicken. Chicken is the most toxic animal you can eat out there. I don't know, chicken and pork, they're about, neck and neck. But go to Foster Farms, or the chicken in the store. Pick up the plastic package and tilt it and see the fluid that comes out. Is that blood or is that like clear pink stuff? Okay, yeah, that's going to have arsenic in it because what they're doing, they're adding arsenic in the chicken food, which is kind of cool if you're running a processing plant because it plumps the little suckers up, and then they look all full and healthy. However, when they gut them, they have a machine that guts them, all that arsenic falls in the soup that they get to soak in because I think it's 10% of their body weight that can soak up this fecal soup. So no animal products, okay? If you want to rebuild your system, you got to give yourself bioavailable nutrients. Plants and fruits are the only bioavailable nutrients out there. It's really that simple. Eliminate sugars. Okay, that means no processed foods, no nothing. And some people say, wow, that's so hard. Okay, then suffer. This is only like 30 to 60 days tops that you got to do this, and you're going to recover. And then imagine if you have pain every time you wake up. If you have fear that you're going to be in a wheelchair. You do this for 60 days and you feel fantastic. Do you think you're going to go back to feeling crappy? I don't think so. I think people are smarter than that. Okay, aspartame, commercial fruit juices, those are all toxic. Completely. Dairy is absolutely poisonous. Dairy is absolutely poisonous. Dairy is absolutely poisonous. What did I just say?
Absolutely.
It's absolutely. It has endotoxins in it. It has bacterial. in it. I mean, you know, they can say pasteurized milk, you know, has 200,000 bacteria per milliliter. Don't worry about it. We kill them. That means you have 200,000 dead bacteria per milliliter. Okay. It's not appropriate for human consumption. 20 years ago, the milk was a heck of a lot healthier. Now it's absolutely inappropriate. Plenty of raw food. Raw food has living enzymes. It's vital. Also, check your iron levels. If people are taking too many iron supplements, it's absolutely not good, okay, because it can build up. That can also, iron levels can mean there's a defect of the spleen. This is why we also check the nervous system at the start to make sure that the spleen is functioning correctly, kidneys are functioning correctly, liver's functioning correctly. Otherwise, you may have an imbalance of this. Low-dose maltodextrin. Now, what's interesting, that's a type of medication that I actually couldn't find any negative side effects to. It actually stimulates or helps certain metabolic processes in the body that may be beneficial. I mean, that blew me away. And chlorella, this will help eliminate some of the mercury from it. Naltrexone, now this is very interesting. Temporary relief, okay, from some autoimmune disorders. This I couldn't find any real negatives on it. It was discovered, and while you're changing your lifestyle, while you're changing your immune system function into something healthy, this would be a good stopgap measure. This gal here, if anybody wonders why I study all the time, like nights, weekends, lunch, and morning, this is the girl that came in from New Jersey. Okay, that's 3,000 miles from our office. I mean, if you look up the definition, Wikipedia cute, it probably has her picture. She comes in skinny. She's scratching her arms like this because she had alligator skin, and she's only about 20 pounds. Okay, 2 years old, failure to thrive. Of course, New Jersey is the highest vaccinated state in the country. They couldn't figure out what was wrong with her, but since she had a histamine response on her arms, remember, what happens if the antibody production of the vaccines attack the skin? You get psoriasis. What happens if it attacks the joints? You get rheumatoid arthritis. So here she is, multiple vaccines. Did she have ear infections?
Oh, yeah.
Okay, good. Multiple courses of antibiotics. So she had no normal flora. She couldn't digest anything, any fats. So they were giving her occasional bites of yams. Of course, the doctor suggested a genetically modified soy-based high fructose formula. I mean, it's like, I don't know if pediatricians are ignorant or evil. I'm hoping that they're ignorant, that they've never taken nutrition, and they think genetically modified soy along with high fructose corn syrup would be beneficial for a child. But it only takes really minimal research to find out that that's not true. She came in the office, we got her adjusted, and I told the mom, I said, look, start putting coconut oil on her skin. She needs healthy fats. Oh no, she's allergic to coconut oil. She won't be. Start putting it on. Stop the vaccinations, okay? Cut down on the steroids. She comes in the office, and this cute little darling, you know, she was upset. She was upset. She threw up right on the carpet. And I said, don't worry about it. What is throwing up on a kid? What's the throwing up? Think of this. Multiple toxicities. Does she have poisonous in her system? Absolutely. When you're throwing up, you're losing acid. So that means you're shifting your body from acidotic to alkaline. Don't worry, her body knows what it's doing. Let her throw it up. Give her a little bit of coconut water. I can't give her coconut water, she's allergic. Give her some coconut water, she'll be able to accept it. And sure enough, over the next few weeks, I mean, obviously she had birth trauma, those are her x-rays. Over the next few weeks, she started to eat more, eat more, eat more. Her skin cleared up almost immediately. Within about 2 months, she was thriving, running around, just cute like you can't believe. A little obnoxious later on, but she was cute. Yeah. So this is the solution. We know the cause, we know the solution. The solution is to allow the body to function correctly. Now, what we do in the summertime, it's a $20 special, and this includes x-rays, exam, physical. We've got a patient coming in from Canada, one from Italy, one from Dubai. They're all coming in. Guess what it costs them to get x-rays, exam, physical? $20, yeah. I mean, if you had the opportunity to help people around the world, wouldn't that be fun? I know it is. My sister's right there. She's got some coupons. She's doing the parade wave. You know, but I got to thank you because, I mean, to come here and to do this research, all of these are put on the internet. It takes a lot to take time out of your day and come here. So, and to focus in on health. And you are the ones that are the revolutionaries. You're the ones that are making the decisions for the families and bringing people to health. So thank you.